we do not fall out of grace. We just have intermissions. So I've had some intermissions, and all of us do, and our patients do, and it is not always upfront that we deal with those. I can only speak from my position. I've done pediatrics now for over 30 years, so that's what I do, that age group. And over the years, what I do now has changed. And one is a change from viewing depression, anxiety from a psychodynamic perspective. Instead, we think of it as rooted in patient's own thoughts. The negative thoughts are part of the cause, not the result of. So in the practice, we have implemented tools and screening tools over the past couple of years, and I found it very enlightening. Why we do it is that these problems for the children, young adults, it causes them much difficulty. It causes them difficulty in school, social interactions. There's many times associated comorbid conditions. Some of the disorders, such as anxiety, have their major onset less than age 13, and it is chronic. It leads to depression, and the average delay of treatment or asking for help, seeking help, is 8 years. So we would like to have that change, and unless we ask, it doesn't change because there's very little disclosure. So the symptoms can be easily not observed, they remain unnoticed, and that lack of disclosure leads to it not being addressed. We have an opportunity in our offices. We see people, I see children on a regular basis as they grow up from baby to college, and it gives me an opportunity that's very unique. We have a confidentiality, we have regular contact, trust that builds, and so everyone who provides that type of care in a patient-centered medical home has the opportunity to also provide care for the soul and the mind and the body. We deal with children with difficulties such as autism. Autism, when it was diagnosed before, was rarely less than age 3, usually over age 3. Parents begin to report problems by as young as 18 months. So if we ask them, it changes. The moderator wanted me to stop here just a little bit more. Perinatal depression is another area that's currently advocated to screen for. We screen all of the moms from birth to 6 months of age. It is by the American Academy of Pediatrics in 2010 reported perinatal depression is the most underdiagnosed obstetrical complication in America. My patients, the kids have a lot more comfort for their self-administered forms as opposed to interview. I find they're very honest on them. They feel that they can answer the questions obviously, and it gives them a language. When I would say, how are you emotionally? Are you depressed? They would say, no. Now they fill out the form. I say, you answered these questions. It appears as though you may be sad or depressed. They said, I didn't know what that was called. So they don't have a language to communicate, and it gives them a way, and it gives us a platform to start to talk about these issues. And the barrier is we might have to get into our own stuff. So in other words, if you're uncomfortable approaching this, asking about it, it may be uncomfortable to screen for it.
Thank you, Dr. Reynolds. Can you just briefly share what you screen for routinely and what tools do you use?
So I have brought with me some copies of the 5 areas that I currently screen, and they're on the table over there if anyone's interested. They're readily available on the internet. I find them to be very time efficient. They're very cost efficient. You can just print them. You can get all the scoring sheets online. You can identify those at risk. It's an opportunity to educate and refer. And it actually ends up saving time, but the implementation will take some time. We use the PHQ, which is a 9-item scale from age 12 up. It is for screening for depression, and that's the one I use also for maternal depression. It's filled out in less than 10 minutes, probably 5. We use the CRAFT screening. CRAFT, C-R-A-F-F-T, stands for CAR, Relax, Alone, Forget, Family and Friends in Trouble, and that's age 12 to 17, and that's for risk-taking for the teenagers. We use the Beck's inventory, which can be used over age 13. It's a little higher reading level, it's 5th to 6th grade reading level, so that is something you have to consider when you're using these forms. It's a 21 question, it takes a little longer, but still it's only about 15 minutes. We use the MCHAT, which is the modified checklist for autism, ages 16 to 48 months. We screen all the children at 18 months and at 2 years. And we use one called SCARED, which is a screen for anxiety-related emotional disorders. And that is age 8 and up. And there's a parent scoring sheet as well as a child scoring sheet to find anxiety-related behaviors. And so all of these we've implemented over probably the past 3 years. We do them one at a time. We do one age group at a time. We look at the flow as we put it into practice in the office. We, after 3 months, look at our success rate, and then we redo the flow to see what's not working, and then usually it gets implemented after that. It also involves education of the staff too. So the start is the choosing the form. So just choose one because the problem is not having one. So there's many options. So yeah.
Thank you, Dr. Reynolds. So the forms are available on that table. Feel free to pick them up, and we want to thank you for bringing those. What a treat. Okay, so we're going to move right over to Dr. Reena Kumar. And her questions that she wanted to pose today have to do with common questions that she finds in her own practice, questions that come from the patients or the patient's parents. So one of the questions that she had was, what are the red flags for mental illness in children? What do you look for, Dr. Kumar?
Thank you, Nanette. So this is one of the most common thing which is asked to me by the parents, by my friends in the community, and by my colleagues for over a phone consultation. And many times in med school, we do not learn enough about these red flags. So basic principle is whenever there is change in the social and the occupational functioning, that is a red flag. And what is the occupational functioning of a child? I'm a pediatric psychiatrist, so I'll be mainly talking about children. So occupational functioning of a child is school performance, his social interaction with people in the family, with his friends. If you're observing that his sleeping habits are drastically changing, he is either sleeping very less or sleeping too much, either eating very less or eating too much, or he is staying alone in a corner, not talking to anybody, or self-injurious behavior. Many times teenagers with the influence of internet are seeing their friends doing self-injurious behavior like cutting or coining or burning. These are the things which teenagers commonly do nowadays in public schools just to give a challenge to each other. And when as parents you are seeing these trigger or warning signs in your child, then this is the first sign that you need to seek some help from a professional. That is very, very important. Other thing which you might see in some children is physical changes. They might frequently start saying, "Mommy, my tummy is hurting, my head is hurting, I don't want to go to school. He used to love to go to school, why now he's not loving to go to school? Is there any bullying going on at the school? Is there any cyberbullying going on?" So as parents, we are the first one to catch these signs. And we have to be vigilant enough to know when to seek help. Does that answer your question?
Yes, you answered question 1 and 2. Thank
Okay.
you. So I had a question here too, because this is what I saw working in psych hospitals for many years, was when a child gets a diagnosis, it often makes the parents feel very uncomfortable and even take some blame. So my question is, how do you handle giving this information to the parents? And do the parents often feel like their child is crazy or that they have caused the problem?
Yes. Most of the time, this is the case when you tell a parent that your child has this mental health issue, whether it's depression, anxiety, bipolar, schizophrenia, or any of the mental health issue. They are taken aback. They are not wanting to accept the diagnosis. So most of the work is with the families first. You have to spend time with the family. If any of you is a pediatrician here, spend time with the family, educate them, give them some support groups, give them some evidence-based guidelines, tell them why this disease is happening. It's not that his child is making it up or the child is crazy. There is biological component, there is psychological component, and then there is social component. Biological component is not in anyone's control. It is happening because there is genetic predisposition, there is hormonal imbalance, serotonin is low, dopamine is low or high. That's why these things are happening. But then there is psychological component is there, then social component is there, in which parents have very big role to play. Schools have very big role to play. So have an open-minded discussion with them. If you have a social worker in the clinic, have her trained in learning about biopsychosocial model. And not only pediatricians, even as a primary care physicians or family physicians, if you have nursing staff or social workers who are trained in biopsychosocial model, they can spend more time educating the parents about it. Parent or the patient doesn't have to start medication right away in the first session. Your first session would be to help the patient accept their illness, and you have won the treatment by 60%. And then your real treatment starts, which is medication and going to psychotherapy, discussing different options to address the child or the patient in the community.
Okay, thank you. That's a great answer. Another question that you posed was, how does a parent make sure that they're raising an emotionally intelligent and mentally healthy child? And what is the role of spirituality in the well-being of the child?
Thank you. This is one of my favorite topics to talk, how to raise emotionally intelligent children. So how many of you feel that you are emotionally intelligent? Raise your hands, please. Oh my God. Okay, so my son raised the hand. Okay, so parenting, most of the people feel that parenting is a challenge. Like Prabhupada said, that Krishna consciousness is simple, but it's not easy. Parenting is simple, but it's not easy. Because 90% of the time, in parenting, the work is on yourself as a parent. And this is what we are forgetting. If I am yelling at my spouse in front of my child, I am teaching my child, it is okay to yell at somebody. So my child is learning the same thing. If I am myself not respecting somebody in front of my child, then my child is learning the same behavior. And parents are the role model for a child. If parents are not emotionally intelligent, not implementing things, then their children will never do those things. So do not expect your child to follow those things, which as parents, you yourself are not doing. So biggest thing is introspection, introspect, where you are lacking as an emotionally intelligent person, and then help your child. Learn from your own example. And 3 big do's and don'ts are when you are helping raise your child being emotionally intelligent and mentally healthy are, first of all, recognize the negative emotions of the child. If your child is crying, do not invalidate his feelings. Always, always validate his feelings. That is very important step. Sit with your child, listen to him empathically, with all the love in your heart, even if your child has broken somebody's nose or broken somebody's arm. Do not start yelling at your child. Listen out to him first. That is the most important thing. Do not punish him. Do not dismiss his emotions. Because if you will dismiss his emotions, he will never come out to you when you are in trouble. He will seek help from outside sources, which would be substance abuse, which would be drug abuse, which would be drug dealers, different people in the community who might not be safe for your child. So make that relationship with your child where he feels comfortable coming to you and talking to you why he did that, why he broke that child's nose, what is going on, and then help him make the right decision. Okay, Tamal, this is not right thing to do. This is not acceptable thing to do. How do you think next time if that child bullies you, how would you react to that? Let's brainstorm it. So parents have to learn patience. Parents have to learn tolerance. And then sit with your child. Write down. Writing is one of the most important things through which children learn very easily. Write down the points. Sit with them. Talk to them about their behavior, their feelings. Believe me, 99% of the time, your child will come up with a solution himself.
Thank you. Those are important. Validate, empathize, and be proactive the next time, and let your child make the decisions about what's the next best step. Thank you. Okay, so now we're going to move to Dr. Dharmendra Kumar. Thank you for asking me to be the panel moderator today. He came up with some interesting questions, one of which is very important to me, but we'll start with, if I'm practicing spirituality, do I need to be concerned about mental health issues? This is an important question, and it poses a conflict for a lot of people.
Thank you, Nanette, for agreeing to moderate. And I'm sorry we have to cover a lot of topics because as the conference title is Holistic Health, so we only have one mental health slot, so that's why we all try to squeeze everything together. As far as the question which came up, Maharaj is here, so he can correct me if I say anything which is not right. But why the conflict? This is baffling my mind. It's a tool which help us to be better practicing our spirituality. So if I have to choose either or, then it be conflict. Why not it can go together? That's the thing. And again, when we talk about mental health illness, and you can take anything, depression, anxiety, first of all, differentiating from, this is how I see it, like just say for example, any medical illness which we all aware of, like high blood pressure or diabetes, they also have categories. Not all diabetes the same, not all high blood pressure is the same. Again, it's come mild, moderate, severe, most easy you can understand. So when it's mild, say for example diabetes, you don't immediately start the insulin. You do diet, you exercise, lose weight, check your blood sugar, follow up, and you don't need medication. If it's moderate, you have to do that. But at the same time, maybe oral medications will be recommended. And if it's severe, then you have to do all this, and maybe you need more extensive treatment, which include even several times taking several combination of insulins. So similarly, if we talk about the mental health issues, they are also mild, moderate, and severe. And not all of them need medication. Yes, spirituality, we all have to do. Like, we all have to, it has a very, very, very important role. But when the disease becomes moderate or severe, then even doing spirituality will be an uphill task. And that time, we are taking some help from something which is available and scientifically proven, taken, several thousands and thousands of people are doing it. It's not just a file. So use it and then move on with your spirituality instead of creating a conflict between either. And it's true, if someone just tell you, oh, you're not doing your sadhana or you're not doing your spirituality practice, that's why you are suffering from this, I will beg a difference on that. It is, I don't see it like that. It should not be blame. Yes, on a mild level you will do it and maybe it's get better. But after that, if you doing it and still suffering, then hey, I will continue to do that what I'm doing, but I'll seek some help which may help me to do and live my life better. So yeah, it's not a conflict, it can go together, mild, moderate, severe, and then we can make the decision based on that.
Okay, great answer. Maharaj, do you have anything to add to that?
Well, what comes to my mind is that before Srila Prabhupada, we all know Prabhupada was a sannyasi. Before he was a sannyasi, he was a grihastha. And one of his children was impaired mentally, psychologically. And Prabhupada went to some expert in the field of psychiatry to try to get help. Prabhupada could have said, "No, you've got to chant your rounds now. All your problems are based on the fact that you're not doing your sadhana properly. You're not doing proper puja and all these kind of things, So Prabhupada resorted to a resource that was there to address a need for one of his children. So that was very honorable, for him to do that. He recognized that there is a department of wisdom, of knowledge, that experienced people who can help in these areas. Perhaps that answered the question.
Thank you. Thank you very much. So the next question is near and dear to my heart. What are people going to think of me when I have to go to a psychiatrist? What are people going to think of me when I have to go into treatment? This is for children, adolescents, and even adults. So there's a stigma around mental health. It continues to thrive. So Dr. Kumar, how do you handle that? How do you educate your patients about that?
To answer this, I want all the panelists to share their experience, because the person who come to my office, he already somehow he had accepted or had been pushed to come and see me. But I think Dr. Reynolds can see better how she convinces the people to come to me.
I have to compose on the spot here. What do? I do this a lot. Identify the problem. Take that opportunity to educate, which might, depending on the age of the child, mean discussing with the adolescent what we're going to talk about with their parent, bringing the parent in. We may not get to a plan for a while. I look at it as a short-term intervention, and I want them to leave my office with hope. And that's big. I'm always there for them, and we just try to crack the door open and how that path, they're going to find that path. So I try to have them leave with hope and the idea that it's okay to ask for help, that we don't have to do this alone. What resources they have will vary, and we'll have to work with that, and they may ask me, but I think that if I'm humble enough to convey to them that it's okay to ask for help and that that's what we're there for, it works.
Thank you.
And you can answer the same, because you also channelize or can counsel many patients.
Right, mostly in the hospital. And the thing that I used to do with many of the adolescents anyway is I empowered them. I taught them assertion skills, communication skills, and I had them come up with what are they going to say to the kids when they leave. So they would get to come up with ideas, or I'd give them ideas, or the group therapies would give them ideas. But I actually was really, and am still into empowering people. And that seemed to work really well.
And how you handle it, Dr. Kumar?
This is a big challenge for our patient population. Like you said, once they are in our clinic, that means they have already accepted their illness. But many times when we do the mental health awareness seminars in the community, this is one of the most common questions. So one common example I give is, say, if you are diagnosed with diabetes, would you just sit at home and not do anything? Would you blame yourself that this is my fault because I have diabetes? Yeah, it could be partly because if you're eating too much every day, eating lots of sweets and lots of fatty foods, that could be partly true, but at the same time, there is a genetic component which predisposes a person to have diabetes, and you're not sitting at home. You go to a primary care physician, you take medications, you do exercise, you take care of yourself to be physically healthy, but at the same time, when you are suffering from depression, sadness, then anxiety or some other mental illness, why it comes to blaming yourself? Why there is a stigma in seeking help from a psychiatrist? If not a psychiatrist, then go to a therapist. Go to a licensed professional counselor. Go to a clergyman in your community. Go to your temple counselor. These are the people who could be the first step of help. And most of the time, people start thinking that, yes, I should take next step. But like Dr. Reynolds said, according to the studies, from the first symptom until the doorstep of a psychiatrist, there is an 8-year gap. And as a community, especially as most of us are Asian community, it becomes our duty to lessen that gap so that we can give more mentally and spiritually healthy years to our God brothers and God sisters.
Thank you.
Thank you. So I think when you said Asian, I may again make difference because I work with several patient population. I don't think it's much to do with any particular race because I work with Spanish, they have the same, African American the same, Caucasian the same, Indians of course, I know Vietnamese, Chinese. I cannot say that someone has very open it with very open heart, accept it with very open heart. So again, education, empowering, providing support, and as a stigma, I think that most of the time people have this concern, like people come to me and they ask me after talking a few minutes, so you think I'm crazy? And again, my word is like crazy is a slang, it doesn't have a definition. So if you're saying that, it means that you don't even know what you're saying. And as far as the disease goes, education is the tool. Once they educate and once they know, they accept it. Without that, just kind of pushing them is not going to do anything. So my one definition which I read, which very kind of stuck in my head, is it's a biological disease with genetical predisposition where psychosocial stressors and early childhood experiences plays a major role. So that include your psychosocial and early childhood genetics which you get from your forefathers, and then it's a biological. So that biological part can be treated with the medication. Psychosocial, we have to work develop a community where people support each other, give them opportunities, spirituality. I don't know what you can do about genetical, that's there to stay.
Okay, thank you. I have one more quick question, and then we're going to open it up to the audience so that everybody can have a chance to talk because we're behind schedule. One question is, do I have to be on psych meds for the rest of my life? And is there an over-reliance on medications versus psychotherapy?
Again, I even want Dr. Ronald's opinion about on this question, how you approach it if the people ask you this. But I'll tell you my, no, you don't have to. But at the same time, it's not a flu, it's not a URTI, just a cough and cold that you will take the medication for 7 days. My answer to them is the problem is not started in 1 week, so the treatment will not for 1 week, but it will take time. And just medication is not gonna help. Whenever we talk about it, I divide it into 3 components: medication, psychosocial issues, work up on that, where the counseling comes, and working on finding a new job, or marital issues. And the third part is their personal growth, where Maharaj was mentioning early, the first talk about walking, physical activities, diet, sleep, bad habits, and of course, like anything we did detrimental to health. So if we all 3 together, then we're gonna get to some good result. And medication is not for life. In some cases, we have to, like in a high blood pressure, you can control it, but when you stop the medication, things flares up. Similarly here, but that's not the case for everyone. Thank you.
Thank you. Dr. Reynolds, would you like to add to that?
Medication. Well, for children who are young, more often depression is acute. And if it's mild and more acute, most of the time it will resolve with support and help over the first 6 months. When we get into more chronic, so sometimes medication has a role, but children are evolving, they're evolving. And so really my goal with them is that they develop coping skills to, as I tell them, ride the wave. So we have life and it's a wave, and you're on a surfboard, they relate to these things that they have to ride it. So somehow it's developing that support and that coping, and it may be something that helps them along the way, particularly if their thinking is so rigid they just can't get out of it, or what I call a scared deer in the headlights.
Thank you very much. Okay, so we have 10 minutes for lucky winners to ask some questions.
I just attended the seminar, and there was a discussion that so many good parents who are Krishna conscious, and they are so interested and very busy with Krishna conscious activity. So how they should raise their children? Because the lady, she asked the question, because parents are busy with the Krishna conscious activity or chanting and all, so that they force on the children that that you don't do this, then I'll tell you to sit in the corner, or you chant or do the Narsimha prayer, otherwise you get this punishment. So those children, when they get age-wise, then they get rebellion and they hate Krishna conscious. So how you deal with those? They're intelligent children, but so how you deal with their children? And number 2, that you mentioned about, as Dr. Kumar mentioned, that I'm in practice of medicine also, but mild, moderate, you don't give the medicine. But all this medicine later on, like Lexapro or any anxiety, any antidepressant, for young children, they do the suicide with that medicine. There are so many cases and so many complications. So the hands are tied to raise the teenagers in this society. Even though you raise in your family good, you want to see your children with good education and good spirituality. But nowadays you see so many parents, and then you have a question that how they will turn out.
Wonderful question. And all the panelists can share their opinion. But to answer the first part of your question, that means we are forgetting what Srila Prabhupada told us. He told us that taking care of your child is your utmost duty. If there is a deity service pending, and if your child is crying, you have to attend to your child. Then only Krishna will be pleased. Krishna sitting on the altar is not pleased when you are ignoring your child for your sadhana, ignoring your child for your deity worship. And if parents are doing that, I'm sorry to say, they are following not following the most important instruction which Srila Prabhupada gave us. And that is the biggest service which pleases Srila Prabhupada, which pleases Krishna, and we should never forget that. And then only we can make those children be spiritual, learn from Krishna consciousness, and be happy in Krishna consciousness. Krishna consciousness cannot be imposed on ourselves, it cannot be imposed on our children. And Dr. Reynolds and Dr. Kumar.
After your heavy point, I don't have anything to add.
And the second part was medication-induced suicide. There are cases in which medication-induced suicide happen, but at the same time, we do have to see how many of those are undertreated depressions or undertreated mental illnesses. There is very, very few, according to research, less than 1% of the cases there were worsening of the suicidal thoughts. There was no suicide attempt. Nobody committed suicide in all the researches. But yes, black box warning is there, and that's why we always have to warn our patients related to that. But most of the time, it is either patients stop taking the medication, either some psychosocial stressor comes up which makes the situation so worse that patient is not able to control the worsening of his suicidal thoughts. You want to add something?
Sure. So again, we have to take the evidences and the reports with context, because the results can be distorted in anything. Like when I do the consult service, just with SSRI, as you mentioned about Lexapro, I want to say that several times I get consult if some patient's sodium gets so low, and hyponatremia is one of the problem with SSRI, but the rate is less than 0.01%, right? So you have to see like what other medications he is on, even a furosemide, Lasix, and then may be causing it instead of SSRI. Similarly, good with antiplatelet effect of SSRI. People in our aspirin and Plavix, and then they put you on SSRI suddenly, like people get concerned. For particularly pharmacists, you get call from Walmart, oh, he's already taking this, it's not so it's bleeding. No, it doesn't. It doesn't practically affect that much, particularly these patients need to be regular monitored. So similarly goes as Dr. Kumar mentioned about it. Yeah, there are cases, but then you have to look at the context. And not only the medication is the only thing, you can use other, depend on again severity. So that I have to add.
So, as I came through the years of pediatric medicine, when I started, I had very little FDA-approved medication for children. So I off-labeled about everything. So, there were some problems. They are required now, the pharmaceutical companies marketing drugs do trials now in children. It's very helpful. So using medications together, drug interactions, the kind of effects it has on kids, we're more knowledgeable now, and I think able to direct the care better. Lexapro is one of those. It's approved down to age 12 by actual studies. The way I explain it to parents, and I know we have a mixed audience, some are medical, I don't want to offend anyone, but I tell them, kids are more impulsive and how they make their decisions are different. They're more influenced by their peers, they get more reward that way, so they don't think like we do. So we often think like we do and not like they do. And so how they're going to make their decisions, we misjudge. They also tend to be more impulsive. So the medications are supposed to decrease your inhibitions. If part of why you are killing yourself or committing suicide is an inhibition and you disinhibit yourself, you may release that. So we have to have respect for that and be wary of it. It also, their defenses may be decreased that are helping them. So there's an element often you don't want to feel. You don't want to feel bad. There's a reason they're staying where they're at. Because when they start to move out of it, it's really unpleasant and it's really uncomfortable. So you're increasing that tendency. So you have to pace that. You have to be careful about it.
Thank you, Dr. Reynolds. We have time for one quick question.
Thank you. I'm Sumitra Vasu. I'm a bone marrow transplant physician. Sometimes I run into situations where people use faith as a reason to reject rational scientific recommendations. I see that even in our Krishna conscious movement, where devotees refuse to vaccinate their children. But I also see in my own patient population where they'll say when their leukemia comes back after transplant, which does happen in a set of patients, I must not have surrendered enough. Or how do you reach to those patients where you don't want to dismiss their genuine feelings, but also when their faith stands as a wedge between them and their treatment?
Yes, so again, the point we were discussing earlier, it's on the same line. Things do happen whether you are a devotee or not a devotee. So if you are mixing the things together, that's where the guidance comes, where we have to separate that. It's not because you are devotee, you are immune to everything. Even we know from, how so many devotees and even they also go through stroke, the motor accident and everything. So it's misunderstanding, and that's where the guidance comes. And if you and I tell, it's generally difficult to convince. So if the thing gets that complicated, then I refer to the higher authority to have an explanation. Because it's difficult to explain that when the heart is so broken. So you have to have some healing, and then that's where the higher authority can help in that. It's beyond, I generally refer them, if they are Krishna conscious, to their, whoever the immediate senior or their spiritual master is.
Thank you, Dr. Kumar. Dr. Kumar, Dr. Reynolds, the discussion is closed and we're on to the next event. Thank you.